Somebody needs a hip replacement. There are several different reasons for hip replacements. Again, majority of it, about 80%, is osteoarthritis. There's post-traumatic arthritis from somebody who had an injury. There's another entity called avascular necrosis, basically where the bone dies. If the bone dies, then it will collapse, and then when it collapses, arthritis will form. And then the other is inflammatory arthritis, such as rheumatoid arthritis, lupus, etc. And so those are the main reasons why we replace hips. And again, what people will feel, pain, discomfort, mostly in the groin, difficulty putting their shoes and socks on, difficulty going up and down stairs, hard to ride a bicycle, things like that. And so motion decreases, function decreases, inability to walk long distances. And once it gets bad enough to where people are uncomfortable and it affects their lifestyle, then they're a candidate for a hip replacement. And the way I do the hip replacement is through an anterior approach. Don't cut any muscles. Get people up walking right away. Again, very, very successful